Welcome to Cancer Fit on Demand, powered by Livestrong and created by Mapletree. Before we begin, take a moment to recognize that you have already made the hardest decision of the day, and that was to press play. Now it's time to move. So grab your water bottle, have your towel nearby, and let's focus on what we can do today.
Hi, I'm Jessica, your exercise oncology instructor with Mapletree Cancer Alliance. This is week 1 of our 6-week program to help you recover from breast cancer surgery. We will start with gentle stretching and flexibility movements, working our way to increasing range of motion. This program is meant to be started about 2 weeks or so after you've had surgery. Please, speak with your surgical team if you have exercise restrictions and if there are certain movements that need to be avoided. For this week's program, we will only need a stable chair. Work through the range of motion that you currently have. Find your limit and work to that each time. Never push past your comfort range of motion or push into pain. There may be some discomfort as you begin to stretch through a surgical site, but if you do feel pain, please discontinue or find a previous movement that felt better. You may repeat these exercises every day. It may feel good to do these exercises right after a warm shower, as your muscles are already warm and relaxed. So let's begin. Start by sitting nice and tall in your chair. We'll have the feet flat on the floor and have the shoulders right over our hips. And start to take just a few moments here to settle in. Before we start any exercising or movements, we'll begin with some breathing to help calm us and center us. We'll do a box breathing technique, and I'll walk you through it. I'll count you. As you inhale, we're going to inhale for a count of 4, hold in your breath for a count of 4, exhale for a count of 4, and then pause at the exhale, hold that in for a count of 4. So exhale completely to start, and then inhale for 2, 3, 4, pause, 2, 3, 4, exhale, 2, 3, 4, pause, 2, 3, 4, inhale, 2, 3, 4, pause, 2, 3, 4, exhale, 2, 3, 4, pause, 2, 3, 4, inhale, 2, 3, 4, pause, 2, 3, 4, exhale, 2, 3, 4, pause, 2, 3, 4, inhale, 2, 3, 4, pause, 2, 3, 4, exhale, 2, 3, 4, pause, 2, 3, 4. Last round, inhale, 2, 3, 4, pause, 2, 3, 4, exhale, 2, 3, 4, pause, 2, 3, 4, and release. Take a few natural breaths here. As you inhale, focusing on the expansion of your chest. And we'll begin with some shoulder shrugs. Inhaling our shoulders up to the ears. Exhale, slowly release them down. Inhale, bring the shoulders up to the ears. Squeeze if it feels okay. Exhale, release down. Inhale, squeezing up to the ears. Exhale, release. 2 more times. Inhale, up and squeeze. Exhale, release. Last time. Inhale, up and squeeze. Exhale, release. Shake them out. Invite in some movement. And then inhale, bring the shoulders up towards the ears. Exhale this time, roll them down and back your spine. Inhale, up to the ears. Exhale, down and back your spine. Inhale, up. Exhale, down and back. 2 more. Inhale, up. Exhale, down and back. Last one. Inhale, up. Exhale, down and back. Inhale up to the ears, and this time, exhale, roll them forward and down. Inhale up, exhale, forward and down. Inhale up, exhale, forward and down. 2 more. Inhale up, exhale, forward and down. Inhale, exhale, forward and down. Take a nice deep inhale. Exhale, gaze out over your left shoulder. Inhale, gaze to the right shoulder. Exhale to the left. Inhale to the right. Exhale to the left. Inhale to the right. 1 more time. Exhale to the left. Inhale to the right. And exhale, come back to center. Nice deep inhale. And exhale, take the left ear towards the left shoulder. Keep the shoulder down. We don't want it rising up, so keep that mindfully down. Maybe take a few breaths if that feels good in the side of our neck. Inhale back to center. Exhale, right ear towards the right shoulder. Inhale to center. Exhale, left ear, left shoulder. Inhale, center. Exhale, right ear, right shoulder. Inhale, back to center. Last time, exhale, left ear, left shoulder. And stay here, or if it feels good, maybe we start taking our chin down and around our chest to where our right ear comes all the way up to the right shoulder. And if that feels good, maybe we take it the other way. Exhaling, chin down and around our chest until our left ear gets to the left shoulder. Take this at your own pace here. If there's an area that's a little tense or tight and it feels good to pause there a moment, feel free to pause. Continue breathing. And we'll take about 2 more breaths here. And on your next inhale, let's bring our head back to center. For this next one, we'll stand up and come to the back of your chair. Start with the unaffected side. We'll take the hand on the back of the chair just as a little stability. We're not going to put any weight here. Put a bend into your knees and hinge at your hips slightly. Let your other arm release towards the floor. This arm is going to be doing no work at all. Imagine it like a cooked noodle. So muscles are relaxed here, can hang heavy with gravity. And if it feels good, see if we just gently swing it forward and back. Kind of like a pendulum here. And if this feels good, maybe these swings get a little bit bigger. Remember, there should never be any pain. There might be a little bit of discomfort. And then maybe we start swinging from side to side. Just little swings here to start. And if this all feels okay, perhaps we start bringing our arm around in a circle. Remember, trying to let our arm hang heavy here. Trying to let our muscles relax as much as possible. And if we're doing circles, let's go ahead and go in the opposite direction. Continuing to breathe. And when you're ready, we'll inhale, come back up, and we'll go to the other side. Place your other hand on the chair, bend into your knees slightly, and hinge at your hips, come forward. Remember, we're not putting any weight on this arm, we're just using it for a little bit of stability and balance. And let your opposite arm hang heavy. When you're ready, maybe start swinging forward and back, just small swings to start, see how it feels. And if this feels okay, maybe we make the swings a little bit bigger. Relaxing our muscles as much as possible. And if this feels okay, let's try swinging from side to side. And if this is still feeling okay, let's try going in just small circles to start. Remember letting your arm relax. And maybe making these circles a little bit bigger. And if you're doing circles, go ahead and switch directions. When you're ready, inhale, press into your feet and stand back up, and we'll come back to our seat. In our seat, we'll take our elbows by our rib cage here, and we'll have palms facing up. Hands can be open or they can be closed in just a loose fist. Take a deep inhale, and exhale, turn your palms face down. Inhale, turn them face up. Exhale down. Keep your elbows at your rib cage. Inhale up. Exhale down. Inhale up. Exhale down. Inhale up. Exhale down. 2 more times. Inhale up. Exhale down. Last time. Inhale up. Exhale down. Inhale, bring the palms back up. And again, hands can be open or in loose fists. This time we'll open, take our hands out to the side. Elbows stay hugging the rib cage. Exhale, back to the starting position. Inhale, open to the side. Exhale, close. Inhale, open. You should feel like a little bit of squeeze in our shoulder blades here, a bit of a chest opening. And exhale, close. Inhale, open. Exhale, close. Inhale, open. Exhale, close. Inhale and exhale. 2 more. Inhale, open. Exhale, close. Last one. Inhale, open to the side. And exhale, close. We're going to keep our arms in this position. And inhale, take your elbows out to shoulder height. So palms will turn face down as we do this. And exhale, bring the elbows back in, palms face up. Inhale, elbows out to shoulder height or somewhere in between if that range of motion isn't there for us yet. And exhale, back down to the ribs. Inhale, up. Exhale, down. Inhale, up. Exhale, down. Inhale and exhale. Inhale and exhale. 2 more times. Inhale up. Exhale down. Last time. Inhale up. And exhale down. Go ahead and release your arms down to the sides. Inhale with straight arms this time. Bring our arms up towards shoulder height here. Palms face down. And again, they might not be to shoulder height. They might be here. That's okay. Inhaling to a comfortable range of motion for you. And then exhale, bring them back down. Inhale up towards shoulders. Exhale, back down. Inhale up towards shoulders. Exhale down. Inhale up. Exhale down. Few more times. Inhale up. Exhale down. Inhaling up. Exhale down. Few more using your own breath here, going at your own pace. And we'll do about 2 more. And once you're done, go ahead and release your arms. We'll take one hand to our shoulder, maybe starting with the unaffected side. And we'll make little tiny circles with our elbows. So maybe imagining like we're drawing a circle on the ground here. We can start just like our pendulum, small circles. And if it feels good, maybe you lift it up to the side just a little bit, not going above our shoulder at all. Making small circles, small movements. Breathing through it. Going at your own pace. And then we'll go ahead and switch directions. Small and slow, working into these little muscles. And maybe some movements that we haven't been doing for a while. So giving yourself some grace and compassion with whatever it is that we're feeling. One more inhale. And then exhale, release this arm down, and we'll take the other hand to the shoulder. And again, just starting out with small circles. This one can also be pointed towards the floor, or maybe we raise it a little bit up, whichever feels good for you today. Making sure that we're continuing to breathe as we move, not holding our breath at all. Just a few more circles in this direction. Again, small and slow here. And then we'll switch. We'll go the other way. Just a few more here. One more inhale. And then exhale, release. Take a moment, move your shoulders in any way that feels good for you. And then we'll take both hands to our shoulders. And we'll start doing the circles at the same time. Again, small, slow circles. Just a few more on this side or in this direction. And maybe you're noticing a few differences from your left side to your right side. It's perfectly natural. And then we'll go ahead and switch directions. Almost there. And one more inhale. Exhale, go ahead and release. Take a moment, let your shoulders rest. And then we'll take our hands and clasp them behind our neck here at the base of our skull and our neck. Elbows are open as much as is comfortable for you. And as you inhale, maybe we open them a little bit more, squeezing our shoulder blades together. Exhale, elbows come closer together, release. Inhale, open up. Exhale, close. Inhale, open. Exhale, close. Inhale, opening, expanding the chest, and exhale, close. Inhale, open. Exhale, close. Inhale, open. Exhale, close. One more. Inhale, open. Exhale, close. And go ahead and release your arms down by your sides. One more time, we're gonna take our elbows to our rib cage here, palms face up. And this time, as we exhale, we're gonna squeeze our shoulder blades together a little bit deeper than what we were just doing so that we bring our elbows back. So the movement is coming from our shoulder blades to move our elbows. And release. Squeeze your shoulder blades together to move your elbows back. And release. Inhale, squeeze together. Exhale, release. Inhale, squeeze. Exhale, release. Inhale, squeeze. Exhale, release. Two more times. Inhale, squeeze. Exhale, release. Last time. Inhale, squeeze. Exhale, release. Good. We might have to move a little bit closer towards the edge of our chair for this next one, making sure that our chair is sturdy and stable. We'll take one leg out in front of us, toes point towards the ceiling, and hinging from the hips, keep your spine as straight as possible. Reach towards your toes. Hands can stay on your shin here, and we'll take just a few breaths. Breathing into the stretch in the back of our leg. Inhale, walk your hand back up and we'll switch. Take your opposite leg out, toes point up towards the sky. Again, hinge at your hips, keep your spine straight and reach towards your toes. Let your hand rest wherever it falls, whether it's on your shin, your thigh. We just don't want to push into our knee here. And we'll take a few breaths. Inhale, walk your hands back up, and we'll take our foot back to the ground here. We'll take our other leg out straight again, and we'll cross our ankle, maybe over our shin here, and see if we can start bending the knee. So if this is enough of a hip stretch in our left hip, we can stay just like this. Or maybe we take the ankle over the knee onto the thigh, staying here, or slowly bending our knee, taking the sole of our foot all the way to the ground. Looking for a stretch in our left hip. Again, stay here. Or maybe we hinge forward until we find our stretch. Forearms can rest on your lower leg here, and we'll take just a few breaths. There should be no pain in our knee. If there is, we can always back off. Inhale, start to rise up. And we'll straighten our leg back out. Uncross. Keep the other leg straight, and we'll take the ankle to the lower leg on this side or to the thigh. And if we're going farther, go ahead and start bending into the knee, bringing your foot to the floor. Again, stay here, or maybe hinge at the hips, lean forward. Forearms can come to our lower leg. And again, taking just a few breaths. If it helps, maybe we flex this foot. Again, there should be no pain in our knee. Inhale, come back up. Straighten this leg, and we'll uncross the ankle. Bring both feet back to the floor. We'll take our left hands behind us, maybe on the chair. Right hand to the outside of our left knee. Inhale, lengthen your spine tall. Exhale as we turn to twist. Continuing to breathe. Inhale, come back through center, and exhale, twist the other way. Again, inhaling to lengthen your spine tall, and exhaling, turning to face out over your opposite shoulder, if that feels okay for our neck. Inhale, come to center, and we'll take our hands to our knees or our thighs, ending with some movement in our spine. As we inhale, go ahead and open up your chest, arch through your entire back, shoulder blades come together, maybe our throat opens a little bit. Exhale, round your spine, bring your chin to your chest. Inhale, open up. Exhale, round. Inhale, open. Exhale, round. Inhale, open. Exhale, round. One more time. Inhale, open. Exhale, round. Inhale, come back into our seats. Thank you so much for joining me today, and I'll see you next week.
You've completed something truly special today. You should be so proud of yourself for pushing through, because we certainly are. Each movement that you made today is more than just an exercise. It's a reminder that movement is medicine. Congrats on a great workout, and we look forward to moving with you again soon. Live strong.